Today's topic will be mainly focused on common rabbit diseases and treatment. There are some common diseases and problems seen in rabbits that can be prevented by ensuring you have an understanding of what a healthy rabbit requires and the signs that can tell you your rabbit is unwell or diseased. The first major problem that can be seen in rabbits is overgrown teeth. Cause and symptoms. A rabbit's teeth continually grow throughout its life, and if a rabbit is not constantly grinding their teeth down by eating fiber, we start to see their molar teeth forming sharp spikes that damage their cheeks and tongue. This causes pain that makes them unable to eat. The incisors at the front of the mouth can, in severe cases, grow around in a curl, meaning rabbits cannot close their mouth or eat at all. Once a rabbit stops eating, their gut stops working and they can die. Now, the prevention of this overgrown teeth is 80 to 90% of your rabbit's diet needs to be fiber in the form of oaten or grass hay. The rest of the diet should be leafy greens with pellets and other treats being minimal to non-existent. Treatment. A general anesthetic and burying the teeth flat is the only treatment that can correct overgrown teeth. The second common disease of rabbits is uterine tumors. Cause and symptoms. Entire female rabbits can develop a cancer called uterine adenocarcinoma, and it should be suspected anytime an undesexed female rabbit becomes sick. Some of the more common clinical signs include blood-stained vaginal discharge, aggressive behavior, mammary gland cysts, and lethargy. Prevention is desexing early at 4 to 6 months of age, that is also called as neutered. Treatment. Desexing hopefully prior to the cancer spreading through the body. The third common disease in rabbits is Snuffles, that is pasteurellosis. Cause and symptoms. Close contact with an infected rabbit can easily transfer the Pasteurella multocida bacterium to your rabbit. Typically, early signs are a nasal discharge, watery eyes, head shaking, sneezing or rattling noise in breathing, and a loss of weight. Continual infection may cause rabbits to become sterile. Now, the prevention. Some strains of the bacteria remain latent in the rabbit's nasal tract until the immune system is placed under stress, such as when a new diet or pet is introduced or if overcrowding occurs. Reducing stress for rabbits that are infected and the quarantine of new rabbits are good ways of preventing introduction of the disease or recurrence of signs. Treatment. Treatment involves a long and sometimes repeated course of antibiotics, occasionally surgery if required, if an abscess forms. The fourth common problem in rabbits is ear mites. Cause and symptoms. Ear mite infestation in rabbits is caused by the parasite Soptris cuniculus. Scabs or a crust start forming at base of inner ear. Mites cause considerable irritation and rabbit will shake its head and try to scratch ears with hind feet. The prevention is do not let unaffected rabbits in contact with rabbits that have ear canker. Treatment. Use a cotton swab to apply mineral, vegetable or olive oil over all visible crust. Usually 1 or 2 treatments is sufficient. The next common problem in rabbits is hairballs, trichobizos. Cause and symptoms. Hair can normally be found in a rabbit's stomach as they self-groom. However, as rabbits cannot vomit, hair must be able to pass through the gut. If it can't, then it will form an obstruction and serious complications. Hairballs are so common that they should always be considered as a problem in any rabbit that is lethargic and not eating. Now, the prevention. Hairballs are more likely to become a problem if there is an issue with the gastrointestinal tract, gut status, or they are not receiving enough fiber in their diet. So, a high fiber diet is a greater preventive measure. Treatment. Sometimes surgery is the only treatment if the hairball causes a blockage in the gut. Medication to get the gut working again can also help. Now, the next common problem in rabbits is enteritis or diarrhea. Cause and symptoms likely caused by coccidiosis or other intestinal inflammation. In young rabbits, excessive greens will cause diarrhea. A watery diarrhea may only be a symptom. Now, the prevention. Develop a program to control coccidiosis. Do not feed greens to the rabbit. Treatment. Keep rabbits comfortable and encourage feed consumption. A medicated or vitamin fortified feed may be helpful. The next common problem in rabbits is myxomatosis. Cause and symptoms. Myxomatosis is a virus that is transmitted by mosquitoes, fleas, or by close contact between an infected rabbit and a susceptible rabbit. The disease is recognized by swelling and discharge from the eyes, nose, and anogenital region. Now, the prevention. Unfortunately, there is no vaccination available. Invest in a mosquito-proof rabbit hutch or bring your rabbit inside at dawn and dusk when mosquito levels are higher. Flea control can help, and when introducing new rabbits, keep them isolated for at least 2 weeks. Now, the treatment. The disease is invariably fatal. There is no cure for myxomatosis. Only supportive care can be given. So, prevention is the key. Next common diseases in rabbit is rabbit hemorrhagic disease virus, known as rabbit calicivirus. Cause and symptoms. Rabbit hemorrhagic disease virus, previously known as rabbit calicivirus, is spread by mosquitoes, flies, and or other through direct, indirect contact or direct contact with an infected rabbit. There are currently 4 strains of RHDV virus: RHDV1, RHDVA, RHDV2, RHDV1K5. Rabbit hemorrhagic disease virus RHDV1K5 will be released nationally in the first week of March 2017. This virus is being released as a biocontrol measure to manage wild European rabbits. In most adult rabbits, the disease progresses rapidly from fever and lethargy to sudden death within 42 to 72 hours of infection. The incubation period for the RHDV is between 1 to 3 days. Most rabbits will show no signs of external symptoms of RHDV. The clinical signs include poor appetite, restlessness, lethargy, and fever. The disease causes acute liver damage with resultant blood clotting abnormalities. These diseases can be fatal due to the obstruction of blood supply in vital organs and or internal hemorrhages. RSDV has a mortality rate of 70 to 90% in susceptible rabbits. Now, the prevention is vaccinating your rabbit will provide better protection against RHDVA and RHDV2, and not in every rabbit. Vaccinations are administered every 6 months for adult rabbits. Adult rabbits that are overdue for a vaccination or have not previously been vaccinated will need to be given 2 vaccinations 1 month apart. Young rabbit kittens can be vaccinated from 4 weeks of age repeated monthly until 12 weeks of age, and then every 6 months. We recommend, along with vaccination, preventing direct and indirect contact between domestic and wild rabbits. Avoid cutting grass and feeding it to rabbits if there is the risk of contamination from wild rabbits. Wash hands with warm soapy water between handling rabbits. Good insect control is also important and will help reduce the risks of introduction of both calicivirus and myxomatosis. Insect control could include insect proofing the huts and keeping rabbit indoors. We also recommend a monthly treatment with the topical biting insect preventative. But please talk to your vet about the correct dosage regime. Infected rabbits should be isolated with care taken to minimize environmental contamination. Treatment. There is no treatment available. Often there are subtle changes in your rabbit's behavior that may be a clue to a disease process occurring. If you have noticed any changes or are concerned about something your bunny has been doing, then it is advised to get them checked by your vet. The earlier problems are detected, the better your rabbit's chances are of living a healthy life. Thank you.